Changes to the way home care is delivered in Rhondda and Taff will go ahead after the authority rubber-stamped the revamp at a meeting today. But councillors were greeted by vocal opposition to the plans as campaigners argue the move amounts to the privatisation of care for the most vulnerable in society. Here's our reporter Kate Lewis.
A frosty reception for the council leader and those attending today's cabinet meeting, as Rhondda and Taff Council accused of putting profit before care.
For me, it's not so much for the workforce, it is actually for the individuals in the community. It's the code of conduct say that we should think about their well-being, and also this voice and control, and we're taking that away.
But some did come to voice their opinion about this current service.
Me trying to lead a normal life as possible, and I can't agree it. You know, they look after me well.
One of the main concerns amongst these is that outsourcing will mean a reduction in level of care.
I'm a bit scared really, because of the excellent treatment we are in now. Will it be the same afterwards? I very much doubt it.
A worry shared by Chris Robinson and her family. Her 84-year-old mother Mo has been receiving care for over a decade.
I'm concerned that she's not going to have the same level of care, and that might affect her health going forward. I've spoken to friends, same position as me, looking after loved ones. They've got private companies and they've had a very different experience to me.
There's also concern over what this will do to a sector already struggling to recruit and retain.
Over the last 20 years, when care has been marketised and gone out to the private sector, pay and conditions for care workers has been a race to the bottom, and we can't get care workers anymore because they're not being paid enough, they're not being treated with dignity. And why should these people, these care workers who work for the council on relatively good pay conditions, pay the price for the shortfall in the council's budgets?
But those arguments fell on deaf ears. After a short debate, the council decided to push ahead and outsource the long-term care.
Disgusting, because there was people in there today that I've actually cared for their parents.
But the council maintain it will strengthen the provision.
What our Director of Social Services has done is review our current service model, and he's come to the view that we could secure best value, better outcomes for our clients, a reconfiguring based on geographical zones that would make this a more efficient model for us.
The carers dispute that. They say there is no care like what is provided through a local authority.
We've got a long track record of providing our services both in-house and through commissioning over 90% of long-term care and support, and we have no concerns over the quality and standard of that care and provision.
And caring is what they will continue to do despite these changes.